How's it going, everyone? This is Dr. Derek with PhysioRight. Just wanted to take some time and explain some of the techniques that I use on some of my clients. So first off, the best way to describe a PhysioRight treatment is like a hybrid between chiropractic care and massage therapy. So a couple of problems with each of those professions is, chiropractor, you're typically going to come in and you're going to get your joints cracked and they're going to send you on your way maybe 5-10 minutes. A massage therapist, they're going to be a little bit less educated on their behalf, a 6-month certification, and they're really good at working the soft tissue, but they're not going to take the time to work the full body with the joints. So the main thing is to have the joints and the soft tissue moving on each other, and then that's going to stimulate the central nervous system to work the way it needs to work for the body to move as efficiently as possible. So that's the most important takeaway from a PhysioRight treatment between chiropractic care and massage therapy, where you're getting both the joints and the muscles moved on each other, so then everything in the whole body is moving correctly. And that's going to allow the body to move as efficiently as possible. So let's say that you have, low back pain or neck pain or any pain along your spine. We're not just going to go to that pain site. So just because you have pain in a certain area doesn't mean that your pain started in that area. So we want to get to the root of the problem. And we're not only going to take a look at that low back, we're going to check your SI joint, your hips, your neck, your thoracic area, as well as the low back to make sure everything is moving as efficiently as possible by the time you leave. And then I'll send you at home with some home exercises where you can reinforce the work that we did in the clinic. So I'm going to take a little time. I'm going to show you some of the instruments that I use during PhysioRight treatment. So right here we have the Graston technique. It's a form of instrument-assisted soft tissue mobilization. So each of these instruments has a different bevel, meaning the treatment surface is going to be a little different from instrument to instrument, working with different contours of the body. So with the Graston technique, it's going to break down soft tissue adhesions. So what that means is, as your body tries to heal itself, you're not always going to heal in perfect parallel fashion with the muscle fibers. So it starts to replace itself with a collagen fiber, which is non-contractile. So essentially, little scar tissue formations. So what we do with the Graston technique is we break down those soft tissue adhesions. It stimulates a healing process to lay down the new muscle fiber cells. So when you go to use those muscles, everything is moving the way it needs to move. No sticking points, less chance for a strain. If those muscles are moving the way they need to, they're going to pull on the joints. And the joints are going to be able to work through their ranges of motion, both for everyday life and sport participation. The Theragun, which is percussion therapy, I like to use this to prep the tissue. So that's going to bring heat to the tissue, make it a little bit more pliable for both stretching, soft tissue mobilization, deep tissue work, and also for the Graston technique. So this is the percussion instrument that I prefer. And then I also like to use cupping, both wet cupping and static cupping. Each is going to have a different benefit. So if you think of your body, you have 3 layers. You have your skin, your fascia, and your muscle. And if after your workout you get a good muscle pump, you're going to have all 3 of those layers compressed on each other, and you're not going to have room for that blood flow to dip down into that muscle to promote healing. So when you're moving a cup, if you guys have ever seen that done, what that does is it lifts that skin off the fascia and the muscle to give room for that blood flow to sit down into the muscle. If you're leaving the cups and you see, someone with like big cup marks around their shoulder blade or down their back, what that does is it takes old congested blood that gets stuck down in between those layers of tissue, and it pulls that out to surface. So there's some specific spots of the body that really benefits. I like to put those around the shoulder blade or around the back, especially if you're having chronic congestion. Other techniques I use, it's more hands-on manual therapy or deep tissue mobilization. So think of it like a very specific deep tissue massage, joint mobilization, and passive stretching. So everything I use here is going to have a specific role to get the body moving as efficiently as possible. On the YouTube channel that I'm making here, I'm going to try to incorporate some techniques that I use, on a daily basis. I'm going to show some more unique cases. Also, have some athletes talk about how they implement the PhysioRight treatments into their off-season and in-season programs. Talk about how you can benefit from proactive treatment, how you can benefit from recovery sessions, and then also how you can incorporate the treatment following a surgery or an injury. Alright, so even though I treat a lot of athletes, specifically Major League Baseball, NFL, and MMA. And even though, you see all the jerseys and the signed baseballs and footballs, anyone can benefit from a PhysioRight treatment. If you're working at a desk, if you're, standing for your work, or you have to drive a lot for your work and you're having, back pain, neck pain, you can definitely come in. You don't have to, have a jersey for your occupation to come in and seek benefit. I'm able to see clients, early in the morning, late at night, on the weekends. If there's a specific time on your schedule, we'll do our best to make sure we can fit you in. We're located in Bonita Springs, Florida, which is, just north of Naples. In addition to this YouTube channel, you can find me on Instagram and Facebook at PhysioRight. For bookings, go through my Instagram, or you can go to www.physioright.com to book, and look forward to treating you. So once again, this is Dr. Derek Rasmussen with PhysioRight. Thank you for tuning in. We'll see you soon.